Welcome, everyone. Thank you so much for being here today. My name is Dr. Kate DeConnick. I teach in the Department of Theology and Religious Studies at the University of San Diego. And along with Mike Williams, who's in political science, we are the co-directors of the Urgent Challenges Collective. So the Urgent Challenges Collective is our initiative at USD that supports research, teaching, and advocacy on the issue of homelessness in San Diego. So today's event is the second program in our Spring 2021 speaker series, obviously on Zoom this semester. And we're thrilled to see such great turnout today. It looks like we'll have at least 30, possibly more people kind of trickling in over the course of the session today. As a disclaimer, we did just want to remind our audience today that we can't cover all of the facts and all of the circumstances surrounding homelessness and COVID-19 in this 1 hour session today. So what we did just want to remind you of at the start of the session is that you're welcome to visit the Urgent Challenges Collective website. There's a resource section there that has some great news articles, reports, podcasts, books, all sorts of other stuff that you can benefit from if you want to check out some additional resources related to these topics. We also just wanted to acknowledge that there's a wide range of people who are in our audience today. So we have students, we have faculty members, we have staff, we have community members. We have people really from all across the country who are visiting with us today during our Zoom session. So we appreciate the diversity of attendance within our audience. And before I introduce our speaker, I just wanted to share a couple of really quick Zoom kind of etiquette and navigation tips with you for our session today. Because we have a pretty big group with us today, we're going to ask that you please keep your audio muted unless you are actively speaking during the Q&A. And that's going to help us to eliminate any background noise during our session. Additionally, because if we have too many cameras on at the same time, that can create a lag in the video. We're going to ask that you please keep your video off during the initial presentation. And then if you would like to turn your camera on during the Q&A session, you're more than welcome to do that so that Dr. Santiago can see your beautiful faces and kind of connect with you more personally. But for now, we'll kind of keep our cameras off. Okay. So after our speaker finishes her presentation, which will be maybe about 40 minutes or so, we'll kind of see how it goes. We will definitely, though, have time for questions and answers. So the way that we're going to moderate the question and answer period for today is I'm going to put the link to a Google Doc in the chat area in just a second. And if you have a question that you would like to ask our speaker, you're invited to type it directly into the Google Doc. And if someone else has asked a question that you think is particularly awesome, you should put a star or an asterisk next to that question so that I know there's a lot of interest in that one question. And when we get to the Q&A session, I'll kind of pull some questions off that document and pose them to Dr. Santiago to think about with us. Okay, so I'll drop that in the chat in just a second. But first, let me introduce our speaker for today. So Dr. Odilka Santiago joined our USD community in 2020, so just this past fall, and she is Assistant Professor of Sociology. Before that, Dr. Santiago completed her PhD at SUNY Binghamton University, and she wrote her dissertation entitled From Jim Crow to Jane Crow, The Policing of Black and Brown Homeless Women in New York City's Shelters. So she has published articles about homelessness in journals such as Metropolitics and Abolition Journal, and her talk today is entitled Homelessness During COVID-19. So I'm going to turn the floor over to Dr. Santiago now. Welcome. Thank you so much for being here with us. And she's going to speak with us for the next 35, 40 minutes. We'll see how it goes. Thank you.
Thank you, Dr. DeConnick. I'm so honored to be able to share a little bit about my experience and my research. And so I want to first acknowledge that this research is really the collaboration and contribution of people that I know who have worked in homeless shelters, that have been homeless themselves, and organization that does work with advocacy for homeless. So I want to acknowledge that this work really, I hope, reflects that. So I'm going to go right in and thank you to the change makers and the work of Dr. DeConnick and Dr. Williams for inviting me to this Urgent Challenges session. So let me share my slides and get into it. Okay. So I will discuss how individuals experiencing homelessness in New York City have been affected by coronavirus, specifically how COVID-19 exposes the contradictory ways, the way that the state cares for those who live in either streets or in homeless shelters. Just just last year in March of 2020, New York City was at the peak of experiencing the effects of coronavirus. And, something that comes to mind that was said by New York Governor Cuomo was, "I don't care how smart, how rich, how powerful you think you are. I don't care how old you are. The virus is a great equalizer." And so he explained that his brother Chris had just gotten COVID and was being sympathetic to those who were getting it. And what he reflects is popular rhetoric and news and politicians really say that the virus doesn't discriminate on the basis of race or class. But I say it really ignores how COVID has impacted particularly housing insecure people. So this discourse is technically correct that it doesn't discriminate on the basis of race, class, gender, but it derails from a more critical conversation, which is that, namely, that the impact of housing, what it has to life and death chances of those who are infected. Okay, so this talk will really show that not everybody has the same risk for contracting nor healing from COVID. And so just like a natural disaster like Hurricane Maria that hit Puerto Rico 2 years ago, or Hurricane Katrina, it really shows in Louisiana, it really shows that the disposability of working poor and racially subordinated communities is really those who are most affected by these pandemics, these moments. So those living in the streets and living in shelters are exposed to life-threatening contacts, and with pre-existing health conditions induced by structural poverty, added on with the isolation that happened during the pandemic, really makes them more vulnerable to death and other social ills during the pandemic. So I'm going to focus today's discussion on 2 points. The first part, I'm going to look at how COVID and the policies around COVID really contribute to the criminalization of street homeless people. With more police, more clean sweeps that targeted working poor and homeless, it really left those to be more vulnerable to death. Okay. The second part I'm going to look at is the way conditions of homelessness highlight the already deteriorating conditions of substandard housing, and particularly the use of hotels that became a way of solving the problem of shelters in New York City, really contributed to another form of crisis, particularly a mental health crisis. So those 2 things I'm going to focus on for today's discussion, hopefully within 40 minutes. Actually, I timed it, it's about 38 minutes, so bear with me. Before we begin, I want to provide the fact that the US has, at this point, 500,000 deaths from COVID. At this point, last spring, New York City was the epicenter of COVID-related deaths. So those that were most adversely affected were those who were in shelters. So in total, New York City had about almost 30,000 deaths, which for those normal, like housed New Yorkers, it was about 231 deaths per 100,000 people. For those living in shelters, it was about double that, at 406 deaths per 100,000 people. So the mortality rate of those living on the streets, that's another measurement that we don't have because it's really difficult to measure. On top of the fact that spending for hospitals was decreased in the beginning of 2020, so that contributed to really preventative measures that could have prevented the deaths of a lot of New Yorkers during COVID in 2020. At 400 million was cut from hospitals in 2020, and about $2.5 million were removed from Medicare expenses. So this is really to show that hospital care was limited during COVID, and especially unavailable for those who were dependent on state funds and state care. So those who are homeless were especially vulnerable to not being treated during this time. What's really interesting about New York City is that, unlike California with homelessness, it has the right to shelter mandate. Since 1981, anyone that can prove that they are legitimately homeless will be provided some housing. New York City is one of 3 places that provides the right to shelter mandate. And on average, prior to COVID in 2019, about 60,000 people were recorded to sleep on average, in a New York City public shelter a night. Of those, African American and Latinos make up about 90% of those sheltered homeless. And within that population, about 2/3 are women with children. Women with children, families are the fastest growing population going into homeless shelters in New York City. And so since March, actually at the height of COVID, which really began in March last year, shelters rejected actually more families than ever before. In 2014, the eligibility, and now for going into a shelter was about 50% of all people that applied for shelter that said that they were homeless and didn't have any other means to any other place to live. About 50% were admitted and found eligible. With COVID in 2020 of March, actually it reduced by half, 26% were admitted into shelters. So already a lot less people were admitted into shelters during COVID in 2020 than before. Now, the way that you just, as a point of eligibility, how you become eligible is that you have to provide paperwork. So for those who are families, you have to provide a kind of a paper trail history of where you've lived in the last 2 years. For single adults, it's 1 year of showing where you lived. And so usually the process for becoming eligible is they provide background checks, they look into other resources, they see if you have a friend or family you can stay with, and basically see that if there's even so much as a bed or a floor you can stay on. Really, it's a process that is very difficult to become eligible. And so this increased problem of eligibility during COVID really has devastating effects, especially for families that are now losing their jobs, and especially those who are becoming unemployed during COVID. So, Columbia University provided a study this year that shows that there could be about 40 to 45% increase in homelessness just from the projections of unemployment rate nationally. Now, nationally, the height of unemployment in New York nationally was about 14.7%. For that in New York City, it's almost double. See, what's interesting about New York City in terms of employment is that New York City has really heavily relies on tourism, on food, service, and service-related jobs. The unemployment rate was almost double. So at its peak was about 20%. By August 2020, New York City unemployment was 16% compared to the national rate of 8.4%. Those affected were predominantly Black and Brown working class communities. So what does that mean? It means that those who are most vulnerable to experiencing new homelessness, especially after the eviction moratorium is lifted in May, are those who are working service jobs and those who are predominantly working class, especially in New York City. So in many ways, we can expect that things might get worse, but we're gonna come back to that at the end, okay? Okay, so for my first part, I wanna talk a bit about the ways that street homeless are adversely affected during Corona, especially through criminalizing and street cleaning. So the way that the street homeless have been treated throughout this global pandemic speaks to how homeless have been seen as very disposable in terms of the health and well-being of the general population. The safety and the well-being of street homeless is only a matter of priority so much as it protects the lives of the general population. And this is where we get to see it, especially through street cleaning. This picture right here was put up in March around what we're seeing as homeless hotspots, right? Where in homeless hotspots is basically where we can expect that homeless people will generally stay. Unlike stereotypes of homeless people, that they're transient, that they just go from place to place, most homeless people will have a specific place that they go where they're protected, where they know other people, where they have some access to bathrooms, food, and services, okay? So when we think about where homeless stay, it's actually very much part of a bigger community. And so at the height of, and in the beginning, especially of COVID, social distancing was presented in public health campaigns as saving lives. And so there were slogans like "Stay home, New York," or "Shelter in place." The state instructed people to quarantine as the principal measure for protecting themselves and protecting others from the virus. But staying at home or sheltering in place was not necessarily a viable nor safe option for many street homeless and sheltered homeless people. So to enforce this, because people didn't initially follow this, New York City Police Department, the NYPD, would ticket up to $1,000 for anyone that was conjugating 10 or more people or walked around without facial masks. So known homeless hotspots were targeted, displaced by cleaning initiatives, right? So people had to leave their normal spots, and without any other resources provided. This not only, disturbed people from their normal spots, sleep deprived, take away their normal schedule, but also fractured communities that have helped individuals survive living on the streets. And so street homeless, this cleanup was publicized as a way to prevent the spread of coronavirus, but actually functioned to criminalize those without shelter. So in response to the initial cleanup efforts, many began to crowd subway carts. By late April 2020, images circulated showed people, because they were removed from their normal spots where they had access to bathrooms and services, people would actually crowd subway carts. And so these images would show them as, people without masks. They would show them in this very disgusting images of them peeing, smoking, throwing trash. And so these images came at a time when ridership was down by 90%. And the train service was becoming limited because people were staying at home, right? And so the Governor Cuomo, said this is disgusting. He said this is disrespectful. This is, to essential workers. And, he really made it a point that we need to target homeless people in these subway carts, right? We need to target and make sure that we help everybody, especially essential workers, but also help homeless, right? So by May 6, 2020, the MTA, the subway carts, closed 24-hour service for the first time in history. They closed from 1 a.m. to 5 a.m. to sanitize cars. You see the images here. And as a response to the homeless that were sleeping in carts to protect themselves from the cold, de Blasio said that he would provide 200 more beds. Now, this doesn't add up because the actual number of street homeless people in New York City, based on point in time references, studies, is only about 3,500 people. 200 beds is not enough, essentially. So in addition to outreach workers, 1,000 police officers were added and deployed into subways to help provide outreach and services to homeless to get them out of the subways, essentially. But, even with the intention to protect and help homeless, adding more police to the outreach actually doesn't work, right? Because police are very much trained to deal with issues of crime, not necessarily social issues, right? Social problem issues. So it really does call to question, what was the point of adding more police officers, right? So these cleanup initiatives not only criminalized those who didn't comply with new social distancing laws, but actually pushed more people out of sight, right? So what we can also see here is that after the subway carts were closed down and homeless hotspots were targeted and cleaned, you had more people going into shelters, but the shelters were overcrowded. Especially in this picture here, it shows that actually about 20 people were sleeping outside of the men's shelters because there were not enough beds, right? And so the problem of using police for enforcing clean sweeps is more visible, especially in poorer neighborhoods too. For example, about 81% of those issued summons for not complying with social distancing were giving tickets for $1,000 were those that actually were people of color. So you can see this image here of someone that's being harassed and actually eventually will be giving a ticket, but forcefully, right? From March 16th to May 5th, there were 374 summons given out in New York City. Of those, 193 were given to African Americans, 111 were given to Latinos. And if one cannot pay a ticket, right, or one does not go to court, they issued a warrant for their arrest. So on the other hand, there are images at the same time that this is happening in Park Slope and wealthier, whiter parts of Brooklyn, where police officers are giving out masks to people who are not complying with the rules, but are given masks as a way. So there are glaring disparities in how Black and brown folk are treated by police and state agencies during this time of a pandemic, right? So more recently, there's a growth of construction in Midtown Manhattan. So while homeless spots are being cleared and clean sweeps are being initiated, there are more people going into homeless hotels, hotel rooms in place of shelters. There's growing constructions and really the eliminations of common spaces, right, where people would occupy. This was taken in December this last year, just upon me visiting. This is around 42nd Times Square, Midtown Manhattan. I don't know if you're very familiar with these areas, Penn Station, which are very popular places for homeless to really utilize and occupy spaces because of accessibility to not only public transportation, but to benches, to public bathrooms, and to places that provide services, whether it's food or other resources, right? Social services. These areas are now under a heavy construction. So you can see, like, with the scaffolding that's developing, there's really the taking up of space that normally people would occupy, right? So in many ways, this new construction that's developing in New York City are really taking up space that people would normally occupy. It's quite empty compared to what it was before the pandemic. And so I went to visit a friend who's living in a shelter that is a shelter made into that was once, she was a hotel that's now made into a shelter. And she was really telling me that there's more needles that are there, it's dirtier, it's more construction, less people that would normally be in these spaces that were there before. And that she described even just like the planks of wood that are used for scaffolding, and I quote, "They're so thick you can build a house on it." And this is her. You can see here that even the space that was once used for streets that people would sleep on and sit on and rest on are now being taken up by new construction. And so really what we see now is the elimination of these common areas that were once used for homeless people to rest, or once used in homeless people, but also anybody to rest. And this is what we call hostile architecture right here. This is in Penn Station, okay, 42nd, Penn Station, 34th Street. And Madison Square Garden, this was once a place that a lot of homeless people that were coming out of shelters would stay while they were kicked out of shelters and had to go outside, right? So you can see that there's a reconstruction of space and encroachment of space that street homeless have lost essentially during COVID. Okay, so now I'm going to talk about the second part, which is the shelter system, and how this is also contributing to some issues for homeless people, right? So the cleanup efforts of homeless technically follows the safety guidelines of the CDC, the Center for Disease Control, but conditions of municipal shelters raise the question of whether living conditions are safer outside or inside. So what is often ignored and what is often left out of the discussion is how substandard housing conditions of shelters and the trauma experienced within shelters really contributed to why some people don't go into the shelter system at all, right? And so this is just a few pictures of, you can see, this is one shelter I took the picture from Ward's Island in the top left. You can see it's like caged up, like very much like a prison, right? This is another one in the Bronx. It's was once a military fort, right? Okay, so shelter conditions generally range from there's 3 different kinds of shelters. There's public shelter buildings, which are dormitory style, about 12 to 14 people will stay in a room, and it's about 35 inches apart. So already the shelter system that is in place in New York City does not provide social distancing. So last year, about 17,000 people lived in a single dorm shelter. Cecile, a 45-year-old Black woman that lived in a shelter, said that, it was a petri dish of germs, and I quote. And so it's a place where if you are in a shelter, you generally are going out and in, whether it's for food, whether it's for work, whether it's for just general rules of there. So in many ways, it's really unsafe, right? So while some people go to shelters to avoid exposures and dangers of living the streets, the conditions inside the shelters are often unsanitary and unsafe. So many sheltered homeless complain that there was no hand sanitizer nor any soap in shelter spaces. And then so even at the beginning, a lot of people that did contract it were in shelters. And so taking another example of somebody who worked in a shelter, a a 50-year-old Puerto Rican woman named Erica. She works as an administrator in the shelter. And oh, by the way, these names are coded, so they're not the real names, just so you know. She actually contracted and she got a fever while working in a shelter last March. And the next day she tested positive for COVID. And so while she was at work, she complained and then she was not tested, but she got tested the next day and then she had to take, go to the hospital and do social distancing. She was, and I quote, so after doing paid leave, she told me that she was actually called every day by her supervisors and told, asked, are you sure you have COVID? She was kind of harassed and she was told that she was trying to manipulate the system essentially because she was being paid to go off work. So after 17 days, she went back into work as an essential worker. A lot of essential employees actually went back even earlier than the 14-day quarantine. But she was also told not to tell other employees because they're, fear of being understaffed, especially because of contraction. And so really, it really shows how, a lot of the workers essentially were not taking, were not able to really social distance, especially those who are working in shelters. Okay. So let me go on. Let me tell you a bit about shelters. So the Department of Homeless Services, DHS, is the shelters that run shelters in New York City. So again, 3 types of shelters that New York City uses. They use public shelters, they use private landlords to house families, particularly in units, and then they use hotels. This is prior to COVID, okay? What's really interesting is the amount of money that goes into shelter systems. And I want to just talk about that before we move on. About $3 billion is spent by the Department of Homeless Services in New York City alone annually. About $2,500 to $5,000 is spent on a private room a month for a private landlord. And usually these are conditions that are really run down, roach infested, rat infested, really not well taken care of, right? And about $8,000 prior to COVID was spent a month on a hotel, on commercial hotels for homeless people. So already the amount of money spent on sheltering people is about double that, if not more than you could pay for rent in New York City, even in San Diego, right? So let's see. What's really interesting that since the pandemic has happened, about 200 of the 700 hotels in New York City have closed down permanently. And of those, 139 are now being used as an extension of the homeless shelters, because the shelter, like I showed you, the shelters here proved to be more fatal than anything else. So New York City finally moved people after much protest into shelters, which in many ways would prove to be really ideal, right? Because now you're providing space and people get their own room, it's safer, right? So about 20% of the hotels are now running as shelters. And so in many ways, this is very ideal, and this is just to show you some hotels that are being used. What I found in my research is that actually, that while the hotels are great for providing social distancing, in many ways, they're contributing to some new mental health issues that are developing there. The loss of community, the loss of just interaction, the movement of people from one space to another has contributed in many ways to being shuffled around, and also mental health issues. So first of all, if you are in a homeless shelter and if you get corona, you are moved from your space immediately into what is considered a hotel just for people who have corona. And while you're able to move around, there's not anyone really regulating you in the same way. You are not guaranteed to get your room back when you return, right? So already, if you have developed a rapport with people in your community, if you have developed any kind of familiarity with one space, then you actually lose that because the uncertainty of returning back to your room. So there's one. Those shuffle from shelter to shelter can lose contact with people they know, they trust, and this uncertainty has contributed to not only stress and anxiety, but also depression that's developing in hotels. So I want to tell you a story. According to a case manager I spoke to that works at an all-women's shelter, she told me about a case of her client. And this is a quote from her, and we're going to read a bit of it. But basically, I want to share that, a lot of people have been moved from their shelters into hotels, into one space, which is wonderful, right? But a lot of people here who have had a history of maybe drug substance use or mental health issues have really suffered as a result. And so I want to read this case from a case manager, whereas she told me that, you know, they're miserable. They don't have anyone to talk to, nobody argue it. And so it's really depleting their mental health. So she has a client who's 40 years old, who was addicted to PCP, who prior to COVID was really making great strides with her. She was working with her. She would see her every day. She was, you know, working on getting housing. And so she was doing everything that she needed to get out of the hotel. And really, after the move into the hotels and living by herself, she, you know, saw her mental health deteriorate. She started going back on PCP, started using again. And so, you know, because COVID, you know, before COVID, she was in a drug rehabilitation program. She was socializing through art class, through bingo, through computer class. And then after that, you know, she was not able to get that out anymore. She wasn't able to she lost her support system. She, you know, is at home. She's by herself all day. So she goes and gets high, right? So because of that and everything, you know, she doesn't have necessarily her doctor's appointment. She doesn't have a normal schedule. You know, with telehealth communication where you can talk to your doctor on the phone, it might be fine to do it, but you don't have to, right? You don't have to answer the phone. You also are just alone with your thoughts. And if and I've talked to many students and faculty and community members that have felt, you know, the anxiety, the depression, the isolation of living during this global pandemic. Imagine what that's like for someone who's by themselves in a homeless shelter and is uncertain of where they're going to be next, right? And already has a history, you know? So I think what has happened nationally is that mental health deterioration and substance abuse is on the rise, right? According to and with lack of medical professionals, lack of therapists around, more people are vulnerable to substance use. And so that is a way of countering and really self-medicating with depression and other mental illness, right? So according to NPR, and this came out just a few days ago, actually, scientists have shown that fatal drug overdose nationwide has increased by 20%. But according to a researcher at the University of Pennsylvania, those who are mostly affected, 50% of the city's Black population from Philadelphia had fatality rates from drug overdose. So in many ways, it is disproportionately harming those who are coming from impoverished neighborhoods, who are racially subordinated. So there's something to be said about that. I'm gonna take another example. Another social worker I talked to told me, who works at a men's shelter for those who have HIV/AIDS, noticed that COVID affected drug overdose through a combination of both prescribed medication and over-the-counter medication. So because patients are no longer going to doctor's appointments because they're isolated, they don't have their normal routine, they are still getting their prescriptions for their conditions, right? But they're also combining that with other substances, whether it's alcohol or other drugs. And so she told me just recently that, you know, she's only been at this shelter for about 3 months, but already has seen 2 people die from drug overdose. So while patients are still getting their medication, they're isolated, they're not seeing their doctors, they're not having their normal routine. People are more vulnerable to death. And so we need to really take in consideration that social distancing is not enough, right? We need to think about how this is mentally affecting those who are already insecure through housing conditions. Okay. And then just to add this, those who are living on the streets who do have substance issues or have mental health breakdowns, if they are admitted into a hospital, they are treated right away. But if one does not have a home address, then a doctor cannot prescribe them medication. They cannot prescribe them any follow-up and follow-through for services if they do not have an address. So those who are street homeless that do not have addresses already are more vulnerable to continual mental health, substance abuse, and also overdosing. Okay. So I want to conclude this because I think it's been about that time, the pandemic illustrates, many contradictions with how people see the root causes for homelessness. The media and the politicians, they project that, homelessness is an individual problem. It's not a problem of, of low income, of actual housing affordability. So community organized since the pandemic actually have seen that it's actually, we are all very vulnerable to being homeless, right? Whether it's being a paycheck away of being homeless, whether it's, increased unemployment that people have seen during the pandemic. And so people have been calling for different movements. It's, hashtag homeless can't stay home, hashtag cancel rent, especially as the eviction moratorium is going to be lifted in May. We might see many more people losing their housing, especially as they've been, high unemployment rate or underemployment, right? The lack of actual living wages that are provided. So, at the same time, something that I want to put forward and have a discussion about, perhaps along with your questions, that if housing is seen as a real human right, if that was the principle of governance, then perhaps these thousands of deaths of Black and brown working poor people could have been prevented, right? This means real low income housing, real affordable housing, not just subsidized housing, right? So New York City, in many ways, while it does provide shelters for homeless people, in many ways, this is really warehousing homeless people. This is really a temporary fix to a larger problem, especially as about 300,000 people have left New York City permanently after COVID. So what do we do with those vacant spots, right? We really need to think about the function of while shelters are great, they are, I'm not saying they provide a temporary fix to a bigger problem. We need to think about permanent, low income housing, not affordable housing. That doesn't make sense. Real low income affordable housing, right? That really matches the amount of people that people make, and also think in terms of providing permanent spaces that people can have. So the criminalizing and the shuffling of homeless through hotels, through different spaces, really kills homeless, using natural causes as the alibi. So the practice of ticketing, shuffling homeless around in streets and in hotels under the guise of cleaning and social distancing get labeled as a way of protecting the general public's health, but at the expense of harming homeless people. And so I want to conclude this by saying housing is a human right, real income. This is my solution. I want to also give a shout out to Picture the Homeless that I really did my research with, and really talk and give a shout out to Nikita Price, who really made this work possible. He also died last year during this, so I want to just acknowledge his work in housing for homeless and civil rights. So thank you. That's it. I got a little emotional at the end.
That was great, Dr. Santiago. Thank you so much. You've given us so much to think about here. I feel like I have 800 questions, and I've been watching our Google Doc populate with questions too. So just a reminder to everyone, we do have our Google Doc that I'm going to pull some questions off of to start with. I will reshare the link to that in the chat right now. If you missed it, if you joined a little bit later, feel free to take a look at the questions that are there. If you want to throw some more on there, please feel free. At some point, I'll also see if anyone puts their hand up or anything like that, their little electronic hand to ask any questions. But we're going to start with the Google Doc because there's some really great questions there. So as of right now, they're all kind of haphazardly stacked. So I'm just going to pull out a few to share with you, Dr. Santiago, if that's okay. And you can, speak on whatever kind of sparks your interest in relation to these questions. So one question that kind of received a star, which indicates there are multiple people interested in this question, was asking about if you're aware of any cities that are trying to kind of buck the sorts of trends that you're describing today, or are you aware of any kind of best practices in the current moment that, if not New York, maybe other cities are trying to put into practice?
Right. Thank you for that question. So the other place that has the right to shelter mandate is DC and Massachusetts, which is great theoretically, but of course, then what are the spaces that we are putting people in? And then what are the requirements, right? It's not even that you can just enter into a homeless shelter, but that you have to sign up for certain state subsidies or welfare, whether it's cash or food stamps, or you have to go into a job work program. You have to go into certain kinds, you have to see a case manager. In many ways, it's like appointment after appointment. My research really talks to women. I talk mostly to women who are in shelters for over a year. What happens is people enter a shelter, they think it's going to be a few months, but the process of getting housing is not necessarily dealt with as the first priority. The first thing they do is they have to see the case manager after a few days, they have to sign up for certain programs, and they have to show eligibility, but not necessarily finding housing. So one solution is like the housing first method. Is like first give us housing, because at the end, like one's stability is really affected whether if you don't know where you're going to live. And so what happens in shelters is that sometimes people are moved unnecessarily and they don't know why. And so that instability of not being able to hold to know your schedule, to be able to control your schedule, it interferes with your ability then to actually get housing. So what happens is like the case manager is supposed to help them get housing, but then they have to go to a work program, then they have to go to different appointments here and there. And that actually distracts them from actually finding housing as the first method. Not that people don't need other help and care. It's not that, but providing someone with a voucher for a certain amount that the state will pay for rent, and then there's not a number of units available, and then you tell them, okay, go to these appointments, but you're not giving them housing. There's not the actual a low income housing available. Then what do people do, right? They're just kind of being occupied with different meetings and not necessarily when there's real actual housing available. Does that make sense? I hope.
Yeah, absolutely. That really resonates with a lot of what we've heard with, unsheltered and unhoused people here in San Diego too. Just the frustrations of dealing with a system where you sometimes feel like you're bounced around between different places. But while housing is kind of, held up like this carrot that you're chasing after, but might not actually be attainable, or you might be on a wait list for 10 years. It's easy to understand why people might become frustrated or disillusioned with a system that operates in that way.
And just to add to that, especially in New York City, the mayor is like inviting more private developers to come in and construct new buildings, and less than 20%, they'll provide some tax breaks if less than 20% are low income. And that's based on the market rate, which is enormously high for New York City because they count not just New York City, but the county, New York County above. So actually, even just the affordable housing, and I say that with, like it's loaded. It's a loaded term that isn't actually affordable because, like, for example, in LA, it's like 170, you can make 180,000 and you could still you could still be qualified for affordable housing, right? So really looking at the wages people make in the local area and then making housing rent really accountable to that, because people in New York City pay about half of their rent. Half of their monthly income to rent. So it's not affordable. And then you invite these private developers that are coming in, and they're invested into the land because that's going to cost them money. They have a lot of empty, high luxury apartments that's going to increase the value of the land, and they don't care if people are in it because it's not going to make a difference for them. So there's a lot of empty lots in New York City, as I'm sure in San Diego and LA too.
Yeah. I mean, the dynamics that you're speaking are unique in some ways to each city, but also just really touch a note, I think, with a lot of what we're seeing locally too. So this case, everything you're sharing from New York is so informative and helpful as we start to think about broader issues, I think, related to homelessness in the United States. Right. There's another great question on here that there was also multiple people who are interested in, which says, you mentioned in your talk that police are meant to address crime rather than social issues. Can you think of a better system for supporting unhoused persons that relies less on police, or are there models that other cities or groups have tried that kind of gets away from that policing and kind of criminalization? Yeah.
So it's in I want to say Oakland. It's not Oakland. It's in Colorado that they actually instead of the dispatch, right? When you call 911, about 70% of police calls that go and get dispatched from 911 to police are about a homeless person on the street. So 70% of the calls that go to police are for dealing with someone that's like just loitering or peeing on the street, or maybe they're drunk on the street or sleeping, right? All things that we do within our home that we're not criminalized for, but when we're exposed, it's seen as a criminal thing, right? So what's happening in, I think it was Colorado, is that they are, and I have to find the link. Instead of dispatch going to police for these social issues, they're going to social workers, right? And mental health specialists, because police are not equipped to deal with people who are mental health, that have mental health issues. And so, you know, what we've seen, especially with the, you know, killings or harassment, or, you know, the brutalization of people who are just on the street by police officers, especially, you know, with Black Lives Matter, which has really exposed this in social media, is that police are not equipped to handle people who are just doing nothing really. So instead, and a New York City mayor has said that now we're going to add more social workers to, you know, deal with social issues that people have, whether they're sleeping on the street or having a mental, you know, health breakdown. This is something that is being more pushed. But the problem is that there's so many police in New York. Like, it's really very much a police state. So then what do you do in terms of, and there are now multi-agency approaches to dealing with homeless, but still, you know, if someone does have a mental breakdown, they go to the hospital, they're not getting continual treatment after that, actually. So we need to talk about, you know, not only just like more social workers, less police dealing with homeless, but also what are ways to really treat people that are having issues, right? So yeah, it is being done now.
Yeah, that's encouraging. I hadn't heard about the specific case you were referencing. So it's good to at least hear that there's some experimentation happening that might lead to some, I don't know, different ways of doing things, right? And possibly a more humane and viable and successful way, right?
Right.
Yeah, you're making me think too about, you know, it's only pretty recently we had our new mayor that was kind of sworn in, you know, in San Diego, Todd Gloria, who's a USD alum, which is kind of cool. But, you know, it's only really recently that we've even come out as a city and said like housing first is the model that we're going to formally kind of put our weight behind, right? So it's kind of like different cities are in different places in this journey to understanding what can be successful for those who are unhoused. Yeah.
Right.
Yeah, there was another question on here too that was thinking about permanent supportive housing as a model, which seems to maybe connect a little bit with what you were saying about services too. Right. So asking how extensive is the network of permanent supportive housing in New York City? And might this sort of model help alleviate some of the mental health or the kind of other issues that you were mentioning when you told that really, you know, disturbing but compelling story about the woman during COVID? So any thoughts about that?
Yeah, so it's funny because in the last election for the governor's race, it was only homeless issues were talked about within supportive housing, right? And supportive housing in many ways would be touching to a lot of the population, but it's so limited because of the amount of funding that goes into supportive housing, which would, you know, require that we have, you know, care all around, right? So then we need to think in terms of like, what is the funding for, or the accessibility of healthcare for people? So in many ways, I think with Corona, like it highlights that there's a bigger need for it. But I think, yeah, I think it's going to be, that's a great question. I think it's going to take a lot more planning and a lot more resources to get to supportive housing, but that would alleviate so much and really touch on so many issues. But really interesting, supportive housing is actually, it's very difficult to actually be eligible for supportive housing. I was doing field work a few years ago and I met a man that was, he was on a, you know, he sat in a chair just like this. It was leather though. And he couldn't move his leg. And he had told me that he's been trying to become eligible for supportive housing because the treatment, the shelters one is way better. His treatment would be, you know, really suffice, but he had to then go and then qualify by actually going to a doctor and being diagnosed with like some kind of mental health issue. So the eligibility to actually qualify for supportive housing is a little difficult. And so it really calls to question that eligibility process. You know, we need to rethink how is it that, what are ways that people are being prevented to actually having more treatment? So it's something that we need to first work on the eligibility and like the accessibility of having mental health care for people, working for people, you know?
Absolutely. Yeah. And let's kind of stay with this theme of thinking about like, you know, this line between policing and services and all this stuff that's kind of woven together in complicated ways. There's a question toward the bottom of our document that's asking, like what should be the role of the police in dealing with those who are experiencing homelessness? And this person is also recognizing that, a lot of the police interactions are sometimes prompted by the calls that they receive, right? So I'm starting to think like, well, maybe we need a bigger shift about who do we turn to when we see things playing out. I don't know, but let me turn it to you to think about, what could a role for the police look like in a better model, if there is one, and how might they respond to these sorts of calls?
Right, that's a great question. So, I mean, obviously, police need to have training first and foremost, right, of how to deal with social issues. And so, even for example, the war on drugs, right, that became constructed politically and socially in the 1970s and really became important in the 1980s and 90s, really treated substance use as if it's a crime problem when really it's a health problem, right? And so if we can teach and unlearn and really rethink that, right? Because it was treated as a crime problem, and it was only through policies that really focus on certain areas and certain people and certain kinds of drug use. But now I think today that is being really rethought, and so just like we transition from treating drugs as a problem, we can rethink how we treat homeless as being problem. And so obviously training, because police are trained to deal with crime problems. They're trained to use force and violence and think about their jobs as being dangerous, right? Essentially. And if you think that your job is dangerous, you will respond in a way that's going to protect yourself, right? Whether it's like through force, right? When, by the way, police fatality is actually super low compared to like lumberjacks and miners. They have higher fatality rates than truck drivers, but that's another conversation. What I would say is definitely rethinking police training, social workers really, and also the fact that, look, outreach workers, they want to provide housing, but some people don't want to go into shelters, right? Because of the experience of being institutionalized and the trauma in going into shelters. Like sometimes it's really harsh and it's something that they don't want to relive. A lot of people that come out of shelters also have PTSD. They have some trauma. So, whether somebody who's going to force them with weapons, and also like they don't want to deal with police. There's a very hostile relationship that homeless people have to police. When I did my research and I was at a soup kitchen and I was trying to get this woman who's 66 services, we walked past a police car and she's yelling abuse. She's like, I don't want to go near this guy. And she's a 66-year-old, very frail woman, that doesn't in many ways doesn't look like a threat, but she doesn't trust the police. She said they stole from her, they harassed her. So if we need to really rethink that relationship between police and homeless, they don't trust them at all. We can't rethink the training, but we need to redevelop those relationships. And I don't think police are going to do it at this point because of the history.
Yeah, you just made a really good point also about some of the forms of trauma that people who are experiencing homelessness, might face over the course of their lives, whether it's a set of circumstances that leaves them, homeless or experiencing housing insecurity, or something that kind of happens to them while they're on the streets or in their relationships with other people. And this relates to one of the questions that we received, which is, you mentioned, substandard housing and also the trauma that people endure in shelters. So this question is asking just to kind of explain a little bit more about what forms of trauma a person might encounter in a shelter, or are there widespread trends that are kind of known in New York City?
Oh yeah, so shelters are really interesting because about 2/3 of people that enter into a shelter have an income. So they have an income through a pension because they're older or they're working. And about women that go into shelters, about 40% of them are going there for domestic violence. So already there's some trauma that precedes going into shelter. But some of the stories that I've heard about people who live in shelters, and again, a shelter is not very temporary. I talked to people that have lived there for, since 2012 and are still there. So some of the traumas include, so shelter rules are very strict, right? They've been described to me by most of the people I've interviewed from 2017 to now as like prisons, right? You have to sign in, you have to come back before curfew, nobody's allowed into your room. And also you can't bring in food, you can't bring in, because sometimes they provide food for you, depending on the shelter, or you have to go out for food. If not, it depends. The shelters vary. And also generally, depending on the shelter, again, if it's like a 12-person, 16-person shelter, some of the conditions in shelters depends, right? So was a few years ago, 2 kids died because they were in a private landlord's building that was being utilized as a shelter, where the city was paying, a lot of money for that unit, and they had a faulty radiator that exploded, and the kids suffocated to death. 2 of the young kids, because of the heat. So usually what happens is the city will pay private landlords, because there's not enough buildings and shelter buildings that have been designated for family shelters, especially. And in the case that's been happening, some of the conditions, whether it's mold, that has caused, kids to get things like lead poisoning, or if it's faulty radiators or rat infested, roach infested, they don't evaluate and check the conditions of shelters in these old buildings that are being utilized. And so landlords will make a lot of money out of these shelter spaces, but not necessarily keep up the maintenance of fixing these buildings up. So a lot of the shelter system places are really poor circulation, bad health, infestation of roaches, which causes asthma, right? Difficulties breathing, dust, right? So there's lots of conditions of shelters that are really unsafe, but also traumatizing, whether it's fighting in the shelter, whether it's being treated like very rudely and being treated as if they're nothing. And, people enter shelters for different reasons. People become homeless for different reasons, right? That's what I learned, especially during my journey, is, could be a lack of support, or also just trying to find affordable housing and trying not to live with a lot of people in your apartment building. So, yeah.
Yeah, you're right. And I think one of the other things that really stood out to me when you were talking too, that I really appreciated that you emphasized, Dr. Santiago, is this idea that just because you're unhoused or unsheltered, it doesn't mean that you don't have a community and you don't have people who you care about. So when you were talking about some of the reasons why people might be resistant to going into a shelter, or, a variety of different circumstances surrounding that, that element of community and what it means, I think, is so important, and can, for some people, lead to success if they can maintain that community. And for others, if they lose it for one reason or another, can be really damaging, right?
Yeah.
Yeah. Good. We have time just for a couple more questions. So I'm going to pick just a couple more off of our document. And then maybe if you're willing to share your email or something in the chat, if others want to contact you with follow-up questions, that could be a good option as well. But one person put, first of all, welcome to San Diego. And they asked, do you plan on continuing your research on these issues kind of locally here? I think you're starting to do that work a little bit already, but maybe you'd like to share a little bit about some of the things you're getting involved with.
Yeah, so thank you for the welcome. Yes, it's been hard because it's COVID time, right? And so I've been trying to be safe, but also mindful that, the organization I'm a board member of is Think Dignity, and they do some incredible work. And like Dr. DeCornick says, Change Makers has worked with them. They're a part of your hub, so they're doing some great work. So yeah, I'm getting involved with also Dr. DeCornick and Dr. Williams, with their work here at USC. But also I am trying to work on a campaign as housing as a human right, as the very basic right, because instead of just thinking of, what is homelessness and how to beat it, but just as what is the basic human right that we have, which is, housing and having that dignity. And so Think Dignity is working on a few campaigns. They have service provided. They do a great work. Michelle is an incredible executive director. Rachel Jensen was one of the founders. I'm working with her. There's some great people involved. So Think Dignity is one. But I'm still exploring, and if you guys have suggestions, I'm very much a part of this. I'm interested.
Awesome. Well, I certainly do, but that can be a conversation for another day.
Yeah.
Great. Yeah, and then maybe as we do our send our follow-up email to everyone who is in attendance today, we could also just share out some ways for people who want to support this work. If they want to learn more about Think Dignity or kind of find other ways of getting involved, we can share out those links with everyone in our follow-up email too, if that sounds good. But any other kind of last thoughts that you want to share or ideas for how University of San Diego can kind of do meaningful support, in this area?
Right. I know that there's so many students that have expressed interest, and eventually I do want to do research. And because honestly, at the core of advocacy, what I've learned is that like the work that college students can do in providing research can actually provide material for politicians, for political campaigns to say, look, we have the evidence that something is not working in the current state of things. It's not just this feeling, right? So students can get involved in research, and I eventually do want to work on research here in San Diego that will provide, this connection between New York and California to say, look, there's something, we have a solution. We've done the research, we know what's going on, we're on the ground, we're talking to people, and this is what we need to do. And it's to provide basic housing for everyone, right? At the core. So
awesome. Good. Well, thank you so much, Dr. Santiago. What a pleasure to share Zoom space with you today and to learn from you and to be in conversation all together.